Welcome to the panel discussion organized at the Leave No One Behind Film Days. Our film selection can be watched on Festival Scope between 5-11 April. We aim to contribute to the activities evolving around April 7 World Health Day. We hope our film days may help to build a fair and healthy world. Leave No One Behind is an initiative of World Health Organization Turkey in collaboration with Ministry of Health, and it is funded by the European Union Delegation of Turkey. We would also like to get your attention to 2021 International Year of Health and Care Workers. It has been designated in appreciation and gratitude for their unwavering dedication in the fight against the COVID-19 pandemic. Our selection primarily focuses on the life-changing health services for immigrants and refugees. The documentaries on our program underline the positive role played by the health and care workers. On our panels, we will mainly discuss the impact of these important services. Today, we have a discussion evolving around the amazing documentary, A Place to Breathe by Michelle Grace Steinberg. Michelle is an award-winning documentary filmmaker and healthcare provider based in California. She directed, produced, filmed, and co-edited A Place to Breathe in 2020, and before that, Beyond Recognition in 2014. And before coming to the other speakers, Michelle, could you please tell us the story of this documentary, how you decided to work on it?
Yes, can you hear me?
Yes, of course.
Okay, thank you so much for having me and for spotlighting the documentary. So I've been a nutritionist and herbalist at a free clinic, an integrative free clinic in Oakland for the last 12 years. So really the inspiration for the documentary came from the amazing resilience that I saw in my colleagues and patients there. When I was trying to think about how to bring that to light, I stumbled across a story on public radio about the clinic that you see in Massachusetts, about Meta Health Center. And I was just completely dazzled by the work that they were doing because it seems so in line with what we were trying to do around bringing culturally responsive care to communities, particularly with providers from their own communities, spotlighting that care. And so I reached out to them, and it built an amazing bridge, both, as a healthcare provider around learning about each other's best practices, but also just as an opportunity to bring these stories to light, told through the voices of people who went on a journey, and learned how to sort of create their own healing through healing their communities. So that's how we came across it.
Wonderful. And one of these people, thanks to your documentary, we've met is Yania Escobar. Yeah. So Yania was born in Uruguay and emigrated to the United States when she was only 13. And she had a passion for healthcare. So in the States, she worked at a community clinic serving immigrants. She became a registered nurse in 2019. And she is currently working at a dialysis clinic in California's Central Valley. So Yania, so we watched your story in the documentary. Would you like to tell us about how you were, involved in this documentary, and how did it make you feel to tell your private story?
Yes, thank you for the question. I didn't know that I was going to be in the documentary as much at first because I wasn't working at the street level at the moment. I had left to enroll in nursing school, and Michelle wanted the story of the street level. But through my story and Edgar's story, it kind of became more relevant as I was going through nursing school, and so I found myself sharing more than I initially realized. So I think now watching the documentary, I really cherish that time in my life where I was trying to become better.
Oh, welcome.
Here's my my little helper. So I think I hadn't thought about what I was doing as being from the community and serving the community until I was in the film. Mm-hmm. And that really made me appreciate the importance of people serving their own communities and, like you said, healing themselves through doing healing work with their own communities. I don't know if that answers the question, but that's kind of my experience of it.
Yeah, and it was very interesting to watch you getting into the school. It was a big challenge. And then in the end credits, we see your graduation, which is really wonderful. You must be very proud. And are you happy working in this field now, especially under these extraordinary circumstances of the pandemic?
Yes, I love my work in dialysis. I get to see the same people day after day and build relationships with them and their families. A lot of them are, here in the Central Valley, Latino immigrants, and people from my community. So it's really nice to keep doing that work. I do a little more of a technical service than I was doing at the street level, but we are able to distribute vaccinations at the clinic, and we test people. So we're really, really active in trying to mitigate this pandemic at the dialysis. So I feel, that I'm involved, that I'm able to do a little something to help us get through this.
Thank you. We wish you courage. We will come back to you and Michelle later. But today we have Professor Dr. Melikşah Ertem with us. He's a public health specialist, and he is working for a special project in Turkey, which is called SIHHAT, which means health in Turkish and Arabic. And it can be a short form of, for the international arena, strengthening immigrant and host community health activities in Turkey. And not only for his, expertise is here, Mr. Ertem, but he examined closely this documentary. And he has a lot to tell us about the film, like a film critic. So, Dr. Ertem, we're listening to you. Please, your voice.
Gerçekten o kadar çok söylenecek bir şey var ki.
Actually, there are too many things to say. Now I see the director. I would like to thank Steinberg. I hope I can pronounce her name properly and correctly, because we have the heroines. One of the heroines of this movie. So it's an unbelievable, great movie. So as an expert in public health, I would like to interpret a bit. Actually, healthcare services have some inevitable principles. Health services can be accessible all the time, and there should be acceptable methods, and it should be existence. So within the scope, of course, there should be cultural cohesion, no language barriers. So, we are talking about the healthcare services. I believe it was so nice. It was explained in a very nice manner in the movie. Actually, I'm really impressed with some of the points. For example, community-based health services. And we have the physician, social care worker. There is the personnel for directing the patient. So they all support each other and they provide the services, and they are all migrants. So this was very appalling for me. I was very impressed for that. And So leave no one behind. So people leave someone behind. So they come to a new place and they lose their social status. Actually, migration has this characteristic. So when we call it migrant, there could be different migrations. I'm not talking about the migrant like for the education, for living in more, in better places. Unfortunately, we have some forced migration. So they lose their connection with their relatives. They come to a new place. They don't know the laws. They have to live in such places. If I start speaking, no one will stop me. I mean, I cannot stop myself when I start speaking. There are for example, I've seen the Cambodians, and in the clinic, you can see rituals, the pictures on the walls. This is like bilingual aspect. There are different labels. They're all bilingual. So also we have migrant healthcare centers in Turkey, and we try to integrate all those labels. I mean, we try to do the same in all those centers in Turkey. Actually, may I go into this topic, the migrants in Turkey? Actually, we have a a little bit softer face because we are closer to each other as the Syria and Turkey. We have differences, of course, but culturally, we have the same religious holidays. So we have Arabic speakers. I mean, we have people speaking Arabic in close to borders. So, migration affects individuals for mental health, for health. It's very difficult. Generally, there are some social determinators for the health. And we can see migration in all those layers. You can see the effect in the family. You can see the working areas. You can see all those effects in the social and political laws. I mean, in all the relevant fields, we can see that migration can have an effect for all those social determinants. We know that. And that's all for my side so far, actually. For instance, actually, I lost my hopes. I remember this from the movie. It was so, it was so striking. Losing the hope. This is, Rose. I am really affected with Rose. Rose was not smiling for the entire movie, and she was always unhappy. Actually, children, the young individuals, they can adapt themselves easily, but that status. She lost her husband. The migrants are in such cases. They have very challenging situation. So that's enough, I think, for now. Then I will take the floor once again.
Thank you very much. When you mentioned losing hope, I wanted to look at Dr. Ramy, Sheikh Muhammed, because he is the living example of keeping up the hope and starting a new life. So Dr. Muhammed works as a physician at the Refugee Health Training Center in Ankara. When the war broke out in Syria, he had to cut short his medical training in Aleppo, and he took the opportunity to work within Turkey's healthcare system after his immigration. It is a part of the European Union funded improved access to health services for Syrian refugees in Turkey. And at the moment, Dr. Muhammed is one of the health workers on the front line in the COVID-19 pandemic in Turkey. So maybe, Dr. Muhammed, you can tell us about how you kept your hope alive and how you built a life in Turkey.
Öncelikle herkese teşekkür ediyorum.
First of all, thank you very much. And I would like to thank the director and also the migrant I mean, when I watched them, actually, I've seen my own story. And of course, there are different stories, I can say. I quit. I mean, it was my last 2 years, and unfortunately, it was during the wartime in Syria. So I had to spend, and I had to complete my education, medical education there, because it was for my future. So, and I realized there was no hope in Syria for me. There was war, and unfortunately, physicians were under great pressure. Unfortunately, there were different groups, and they were kept with those groups, and they force you to work for their own objectives. Unfortunately, I could not complete my education, so I migrated to Turkey. When I migrated to Turkey, at the beginning, I was always thinking, I was asking the questions. I graduated from a department in Syria, then I'm going to be integrated in the system in Turkey. So I had concerns, I had my concerns. Later on, I realized the project. I mean, this project was initiated, which was founded by the European Union. And then this was the opportunity for me to provide services for my community and also for the migrants. And we provide all those services in their own languages without any language barriers. And most of the families, you know, they lose their wives, husbands. They were too many disabled children. They were the wounded ones from the war. So we try to reach all of them within the scope of this project. And all of those individuals had the opportunity to receive the healthcare services with this project. I watched the film and I witnessed most of those experiences. I mean, unfortunately, most of them were experienced in real life.
Thank you very much. You know, it's really very encouraging to have you here with us, but also very encouraging to have Mrs. Elif Elci as a representative of the European Union delegation, because European Union is the institution which makes all these possible with its funding. So Elif Elci is the project manager for the improved access to health services for Syrian refugees in Turkey. So she has a key role in all the projects we have mentioned here, including SIHHAT. So could you a little bit elaborate all the work the European Union has been doing in Turkey and in general for the refugees and immigrants, please?
Teşekkür ederim.
Thank you very much. Of course, we have the IPA program for the financial assistance for the immigrants and also for the co-communities. So we provide the services within the scope of those projects, and we give priority for some of the issues for the refugees and migrants. You know, this is a very significant issue, and we have been working together with the Ministry of Health and the WHO. So we provide support for establishing such systems and try to have the access for the accessibility of all those services. We have too many activities conducted. Actually, we try to explain all those issues within the scope of art. For this reason, I would like to congratulate and thank all the actors, actresses, and also the director of the movie, because sometimes we need to explain some of the significant issues with art, because then we can understand we have a part from our own lives. We have our own experiences in the movie, in our own works, because we have our own stories in our lives. For this reason, I would like to thank all of you. And we have the culture and the language issues. We pay attention to culture and language issue. So we need to have the health integration and being together. So we have realized that we can have all these together. And as Dr. Melikşah stated, we have an easier adaptation and integration in Turkey. We have serious activities conducted in Turkey within the scope of SIHHAT project. we can provide services in their own languages for migrants. And another unique example in our country, we have healthcare workers who received their medical faculty education in their own countries, and they were able to provide services in our country. So we have seen that they can realize their own profession and they can provide services for their own communities. This was very unique. So we can see in this movie that there could not be any, I mean, there could be the service providing. Migrants can provide those services. So these people can be the leading, I mean, the directing personnel. So all the activities can be performed smoothly without any problems. And within the scope of the Turkish health system, this is a very great fund. So actually, we could not see such examples in the world. We host 4 million migrants in our country, and it's really not possible to fulfill all these services and needs of this population, as Dr. stated, the disability and leaving the family behind. So we overcame all these issues in our country, and as the European Union, we've been working together with WHO and Ministry of Health in Turkey, and we will continue our support funds in the field of health, not only with the projects, not only with the services, of course, advocacy and art. We are going to be there for art because this is the case of the world. It's a global case. You know, we have realized that in COVID, if we will have a single patient having COVID, then you cannot cure and treat the community. So this is a great journey. Thank you very much.
Well, we thank you. When we go a bit deeper into the project, I would like to turn immediately to Mrs. Hanna Radysh, because she is the monitoring and evaluation officer. She's capable and responsible to give us all the data and almost all the field work, and she collects the reports and makes the analysis. I think you can give us a lot of insight to this project.
Thank you, Alin. And actually, I wanted to say that this movie I enjoyed a lot, and it resonated so much with the work that also we do in Turkey, especially what relates, between our project is that this holistic approach that to the health. That we don't take health as a medical need, but we look at it as a, of course, it's as a physical, but also mental. And this is something that the project that we established together with the support of EU, with psychologists and social workers, that also working together with healthcare providers, with refugee doctors and nurses, and making sure that in addition, also the bilingual patient guides, and this is a critical component for integration, for following up on navigating the system, whether it is available, specialized like refugee units or not. Like in many countries, bilingual patient guides are recognized as an essential component of providing care for refugees, and this is something that we do in Turkey. And this is something that I enjoyed also watching how it works outside of Turkey also. And this is a universal concept. And I think that here, important to highlight that, yeah, we should not treat health just as a physical part, because mental health is very often overlooked, especially when we're talking about, refugees. They're not migrants, yes, they're forced migrants. So they're coming from the situation where they were not safe. And finding safety and finding trust in a new place, in the host community, this is something that we need to help build. So employing doctors, yes, with the SIHHAT project, with WHO support, providing the adaptation training for these doctors, but also added up with the provision of psychosocial support and translation on all levels of healthcare. I think this is something we're looking at every country where that is hosting refugees. And of course, Turkey is an exceptional example here with the scope of it. So we're looking into more sustainable solutions, and this huge project that is run by SIHHAT and in complementary, yes, with the project that we have between WHO and EU is something that we feel very passionate. And Michelle, the movie that you brought to life, it kind of gives this feeling that we are not alone. Also, in every part of the world, there is a challenge of different scope. So I guess the last thing that I wanted to say about this part is that one of the most striking citations, yes, that I got from that movie, and I think there's something that we all need to remember when we bring this cultural responsive care, yes, is that we need to treat people the way as they want to be treated. And I think this is what all brings us together, yes, here in all projects.
Thank you so much. And at this point, I'm looking at Michelle, and then as a film critic also, I would like to say how impressive this film is on so many levels. On a social, in fact, a socio-political level, maybe everything was open, but also when I looked at it, seeing when you used animation to express the feelings of people, especially the violent ones, it was an incredible way to abstract it from the hopeful, positive tone of the film. So it was a multifaceted, multidimensional work of art, not only, a documentary about refugees and, health system. So how did you structure this multidimensional, multi-level film? Oh, you're unmuted. You're unmuted.
Can you hear me?
Thank you.
First of all, thank you so much to all of you for the kind words. I can't tell you how much it means to me to hear this, to feel like this project that we worked on for over 4 years, is really seen, and by extension, I would say that probably everybody in this chat room at the moment shares some sensibilities if we are all able to feel and see the same things in these situations. So, I think coming to the project as a healthcare worker, as somebody who's been treating patients for over a decade, I think it enabled me to sort of approach it in a way that was cognizant of the layers of trauma that were really happening in the process. And so something that was very central to us and was central to me in my last film is that the filmmaking process needs to not re-traumatize people. And for anybody who's worked in documentary, even when you come to it with that intention, it's still going to be a difficult process, because sharing your story, trusting someone to open up and translate that story is a challenge. And we were blessed to have all of these people who were able to stand up and share their stories. As a filmmaker, accountability is extremely important to me. So at each stage, sort of taking the project back. So for instance, when we brought in the animators, when the original concepts for the animation, so we worked very closely with the design, and then I would bring that back to Norma or to the Columbine family and say, does this look right to you? Does this feel like it represents what happened for you? And making sure that it was really intentional to use some sense of metaphor in the imagery, because it felt we're not trying to create a gratuitous depiction. We're trying to capture sort of the layers of impact that those that people's histories have on them. And so that was all a big part of the process. I think for me to answer a question as large as that, I think I'm just going to sort of pick at certain corners of it. No, it's fine. But just a lot comes up for me. So, I mean, another way that I approached it was very intentional when we're talking about language, that when you see situations where there's an interpreter, that I didn't run the interpretation on top of the actual exchange between the provider, the person, the patient, and the interpreter. Because for me, right, so I see my patients in Spanish, and I'm fairly fluent in Spanish, but most of our patients from Guatemala, as you saw in the film, are indigenous mom speakers. So in that case, I have, our mom interpreter in the room translating into Spanish for me. And when the patient is speaking to her, it's not an exercise in sort of just waiting till it gets to the translation. It's an exercise in looking at body language. It's an exercise in looking at all of the information that's nonverbal, that's being expressed by the patient telling their story in that moment, in whatever language it is. And so I wanted the viewer to be able to experience that and pay attention to that prior to getting the verbal translation, because I think that's an exercise in empathy. And I think that for me, at the very core, and I assume everybody else in this room, is the idea that there's no us and them. Any one of us could be a migrant or a refugee, given a shift in the political situation, given a shift in our level of privilege in the state of the world. And a recognition of that brings to it the idea that we're not doing charity work. We're working together with people towards empowering them to be able to create the services that they need most. And I really appreciate what Hanna said, because my favorite line in the movie is when Sonnet says, it's not treat people the way they want to be treated, not the way we want to be treated. Because for this to work cross-culturally, we have to look at the fact that maybe we don't all want the same thing, So I work with my patients so we have a doctor. So our clinic is divided, as you saw in the film, into different services. So I'm so grateful and blessed that down the hall from the clinical portion, I have a number of colleagues working on social determinants of health. So throughout COVID, we're providing food bags. We normally have community lunches. We have folks who work with our day laborers around wage theft that they might be experiencing. We have a workers collective to sort of empower people to look for jobs. But in our clinical side, it's myself, a doctor or a nurse practitioner, and our mental health provider. And I'm in many ways sort of bridging that, because I'm working with patients on diet, exercise, sleep, and stress reduction. And then we jointly, all three of us with the patient, come up with a treatment plan that represents how they want to approach the issue. So for many of our indigenous patients, if there's herbal remedies that they can try for sleep or for anxiety, rather than resorting first to medication. And for me, I believe in all the tools in the toolbox, right? So I think we're trying to figure out the ways that we can choose the appropriate tools at the appropriate moment. And a large part of that is what it means to be culturally responsive, and what it means to ask the patient to express what their needs and preferences are. And I will say that throughout COVID, so we've kept our services going throughout COVID. And I see all my patients by phone at this point, because telemedicine that we've all come so greatly to depend on doesn't translate in a situation where people don't have access to technology. So, I'm on the phone 3 ways with our mom interpreter, with the patient, and then I do deliveries to people's houses of herbs and supplements. And my colleagues are at the clinic doing food bag distribution, and we're trying, as Yania said, we're sort of all trying to do our small part in addressing how do these services that were already challenging to provide, how do we provide them respectfully during the midst of a pandemic? And where, we recognize that everybody's experience of the pandemic is different. Everybody, in the US, our communities of color, our Black and Brown communities, are so strongly impacted in a much different way. And the stories that I hear from my patients are appalling. We look at access to vaccines, and we say, in the US right now, I think we're about 20% vaccinated. There's 130 countries around the world that haven't even seen their healthcare workers vaccinated yet. So I think that we're kind of constantly looking at how do we, again, I sort of go back to what Yania said, how do we take the little piece of what's in front of us and show up for doing it in a responsive way, and in a way that really respects the culture and the cross-cultural relationship. So I'm sorry, I ended up shifting that much more towards healthcare, but I would say that all of those values that I'm talking about permeate how I approached making the film. And so I think it was a constant dance of saying, how can we interweave these stories? One other point I'll say is that, as you probably noticed, the quotes status, the immigration status of people throughout the film was all very different. So we have people who are designated as refugees, we have people who are asylum seekers, we have people like Yania who are on DACA. And part of it for me, not harping on that throughout the film, is the idea that everybody is human. Everybody has their story. And we can create all these categories of status, but at the same time, if we look at people's human experience, they're very similar and they intertwine in all these different ways. And so, yeah, those were some of the considerations that went into it.
Astonishing. Thank you very much. Really, you know, it really moves us deeply to listen to you. And then I was watching the faces of the doctors while they were listening to you. Dr. Ertem is a public health specialist, and I think the concepts of you know, empathy and respect and your approach to treating patients must be, you know, something that he really appreciates in the film. What do you think, Dr. Ertem? You're muted.
Evet.
Yes.
Çok teşekkür ediyorum.
Thank you very much.
Yani hakikaten bu
Actually,
hekimlik açısından
in terms of being a physician, establishing that communication and trying to behave in accordance with their culture, this was greatly reflected in the movie, because you have the meditation, you have the cup at the same time. I mean, there are traditional methods, and we can see the modern medicinal therapy. So we can see the needs, and then we call it acceptable. We accept, and these methods which are acceptable by the community. So they are all together. So we can see there were great jobs fulfilled. And I would like to address the conditions in Turkey. We have 187 centers in different provinces, and we have 4 million Syrian refugees in Turkey, and we have other migrants. It's about 400,000. In Turkey, we have nearly 5 million migrants, and we try to provide services in our migrant health care centers. We only provide medicinal services for the Syrians in those centers, and we provide primary health care centers. We provide the vaccines for the children, and we have the cancer screening. We have reproduction, family planning, and consultation. We also have the follow-up for the pregnant and the new mothers. So we have all these programs, and all these programs which are conducted in Turkey, they are all conducted in those healthcare centers for migrants. It's equally provided, the same service is provided. And of course, there is a good way of establishing these migrant healthcare centers because of the cohesion. The providers, the service providers, they're all Syrians, the nurses, the physicians, the translators. As in the movie, so individuals providing services to the communities, and they are a part of the community. This was the statement for the social worker. I remember such a sentence. It was a very striking sentence for me, because we have our Syrian healthcare workers, and they are providing the services, and they're also part of that community. And we have a second acquisition. Actually, I would like to emphasize on that. For the social status of the migrants, this is one of the problems for the migrants. With all those migrant healthcare centers, it's not really possible to say that we gave their social status back to them, but partially we have our physicians, nurses, translators, so they provide assistance to fulfill that social status for them. We have great workers, you know, they're like the top ones, number one in Syria. So we have some patients still coming to Turkey for the examination. We have a very valuable, for example, we have a great physician and this person works in the primary healthcare. So we cannot say that we gave their social status back, but we try to give it to them. I hope this will be fulfilled in the future. And
Yeah.
okay, that's all from my side.
Thank you very much. Yes. And because I would like to ask Dr. Muhammed and Shania that, I mean, this experience of, being forced to become a refugee because of the situations in your countries, and then, and now you're providing healthcare to the people who were once in your position and then working. So how did this experience change you in relation with the film and in your private lives? How would you comment on that? Any of you could begin. Yes, please.
Şanya Hanım buyursun. Öncelik.
So,
I would like
Shania,
to give floor to Shania. I would like to give floor to Shania first.
yes. Could you follow my question, Shania? Oh, we can't hear you. You're muted. Thank you. Still muted.
Okay, try again.
Okay,
Thank you.
thank you. I think for me, it's really brought on an awareness of course, when I want to talk.
Well, of course.
I think it's really brought on an awareness of my privilege as an immigrant within this community, and just realizing people's stories, and meeting so many people that would love to support their community, but it's just hard to navigate a system in a different country to try to get the credentials that are necessary to do the work that you want to do and sustain yourself and your family at the same time. So that's, I think, the most important thing for me to point out, that my situation in coming here and the opportunities that I've had are in relation to some of that privilege. And I think the most important message that came for me through the film is that we, even as somebody might see it from the outside and say, oh, all these people are refugees or all these people are immigrants, we're as diverse as anyone else. There's so many different stories and so many different types of services that are needed, that there really is a place for everybody if we just support each other and find ways in which to help people to become who they want to become for their communities. And like Michelle said, to show up in the ways that they want to show up for their own communities and for, other communities like I do. I don't work with almost anybody from my country specifically, but I work with a lot of people who come from places that speak Spanish, and so that connects us, or places that their parents have to do certain types of work, so that connects us. So I think it's important to realize the diversity inside communities that we see as homogenous, or the same type of people, and it's really the most important message that I hope that the film would give is that we need opportunity. That it's great, for people to watch a film and feel about it, but it's after you watch the film what do you do? You know, do you have a scholarship fund, or do you want to donate to somebody to be able to go to school, or do you know, how do you support people to do the work that they came here to do? I hope that answers the question.
Yes, of course you did. Thank you very much for your contribution. So, Dr. Sheikh Muhammed?
Evet, aslında göç ne kadar kötü bir şey olduğunu
Actually, we know migration is not something good because we are all migrants ourselves. When we provide those services as migrants, then we can understand and we can put ourselves into their shoes because we also understand their mental health. I mean, we can understand their feelings. Then we can feel what they feel in terms of mental health. I know from my own patients. For example, they come and visit the Immigration Health Center, and these centers were established after the war, I mean, after the conflict in Syria. So when they applied to those hospitals, it was very difficult for them to explain themselves, to express themselves. When establishing these centers, when they applied to us, then it was very easy for them to express themselves. They were pleased, they were happy in terms of mental health, and they were relieved. So too many stories are like that. And for us, once again, we are able to provide our profession. Once again, we continue our lives, because when you migrate, you leave everything behind. You start from the point of zero. So you start your life from the beginning. From this perspective, as healthcare workers, as physicians, you know, we have the community migrating. So you can see, but now we provide our services, we provide our qualifications, so we're not isolated. We have success stories, then this will be like an example, a very good example for the migrants. And also we know that the developer, the founder of the BioNTech vaccine, they're all migrants. We know that they're also migrants from Turkey. So we are going to have those success stories, and then we are going to contribute to them. So we have the kids applying to our centers. So they go to school, and then, you know, we have completed the 10th year. So we can see they are 17, 16 years old. When they came first, they were 5 years old, 6 years old. So when we ask, what do you want to be in the future? They call like, we would like to be a physician. We would like to provide services and help. So we are really pleased to be as good examples for the community. And we're really happy and we are proud of ourselves and the activities conducted by ourselves.
Thank you very much. It has indeed been a very fruitful panel. So may I turn to Hanna and ask for a final statement on behalf of World Health Organization, and give the last word to Elif on behalf of European Union.
Thank you, Alin. I would actually like to use my last sentences to echo a little bit what Shania and Ramy have said. You know, that first, we have already capacity within the community of refugees to serve that community. And that community that understands each other, that doesn't need to be translated, that doesn't need to be interpreted in any way. And not only this community enriches the country that they're coming to, but they already self-sufficient. The only thing that we need to do as international and community, as host countries, is to enable them. And this is what we're trying to do. So I think that was amazing discussion to hear how all these enabling functions, you know, come together and bring something bigger and better to life.
I'm sorry, I was muted again. Thank you so much, Hanna. And Elif, so the last words on behalf of the European Union, which supports all these efforts.
Thank you very much. So Ms. Michelle stated that healthcare workers are like the bridges. We can say that healthcare services, they're also bridges because we have the migrants, refugees, and they're in need of healthcare. And mostly they go and they be a part of life for the need of their healthcare. I mean, they go and apply to a healthcare center, then they go to the employment, then they can be in the community. So they can have different journeys, different ways. Especially this is very important for strengthening the employment of the women migrants. So we need to provide quality, accessible, culture sensitive healthcare services, and this will be our main goal. Of course, everyone can have a different story, everyone can have a different need, and this will be our responsibility. So what will you do after watching the movie? This was the question asked, so we need to ask this question to ourselves. I'm going to ask this question to myself, and I'm going to answer like we are going to promise that we are not going to leave anyone behind, and we are going to continue working for that. Thank you very much.
Thank you very much for these excellent last words. I cannot, thank enough for your wonderful contributions on this panel, for this wonderful film, and for inspiring us hope. Thank you very much to all the people who listened to us. So we will leave no one behind. You may continue watching films and panels on Festival Scope until the 11th of April. Goodbye, everybody.
Thank you so much.